Hi, welcome back. Today I'm going to discuss regarding NGN type of questions. In that today we are going to see about a bow type question with the help of a case scenario. Here I'm going to help you to walk through how we should solve this type of question. So let's go. The question says the nurse is assigned to a newly admitted 49 years old client. Here, there are certain aspects which are being mentioned in the question, that is the health history, the nurse's notes, the vital signs, and the lab results. Here, in detail, the nurse's notes are being mentioned. It says, if at 15:30, client admitted to emergency department with partner, report of feeling extra tired for a week and has been experiencing intermittent chest pain and dyspnea today, and he also had a right ankle ORIF, that is open reduction internal fixation, about 10 days ago. Other history includes several recent anginal episodes, and this particular patient has the history of diabetes mellitus type 1 and GERD, gastroesophageal reflux disorder, and on admission the blood glucose level says 159 milligram per deciliter. So here what we are going to see is the nurse reviews the client's admission note to prepare the client's plan of care. So here we are going to complete the diagram by selecting from the choices below what condition and the client is most likely experiencing. So we are going to select two actions the nurse would take to address the condition and two parameters the nurse would assess the client's progress. And finally we are going to find out what is the particular problem or the condition the patient is facing with the help of the question which is being provided to us. Here the nursing actions are given as start continuous heparin infusion number 1, give IV regular insulin number 2, insert NG tube to low continuous suction number 3, administer oxygen 4 liter per minute via nasal cannula, and number 5th is administer sublingual nitroglycerin. These are the nursing actions which has been given in the question. And next what we are going to see is the condition most likely experiencing. Among them the options here are pulmonary thromboembolism, upper GI bleeding, and diabetic ketoacidosis. And the parameters what we are to monitor, the options here are monitor the blood glucose level, oxygen saturation, pain level, vital signs, and serum creatinine. So these are the data which are being provided in the exhibit button. So we have to select accordingly what is the appropriate answer in each given boxes, what nursing actions has to be done, and what condition the patient is experiencing, and what parameters we need to monitor in the patient. With here I am going to tell you the rationale why, what are the correct answers. So the answer here is the client with orthopedic surgery who had an ORIF within past 2 weeks, the client have this type of surgery are very high risk of post-operative venous thromboembolism, and it also may include the pulmonary thromboembolism, which the patient typically manifests with sudden onset of chest pain and dyspnea. Although the client has an elevated blood glucose level, but there is no indication of diabetic ketoacidosis. Therefore, the IV insulin is not the correct option here, and it is not necessary at this particular point of time. And the patient is having chest pain and dyspnea when resting. might indicate an unstable angina, but there is no evidence that the client had a stable angina. Stable angina will have some shortness of breath, so we can rule out this also, that it is not angina. And there is no evidence there is an upper GI bleed, so the option to insert an NG tube and keep in slow suction also been omitted here. And there is no history of nausea or hematemesis which is being stated in the history, so here this is also the wrong option. The only diagnosis which is appropriate to the condition is the pulmonary thromboembolism, that is the PE. It is confirmed by the pulmonary CT angiography, where they are going to see the ventilation perfusion quotient, that is VQ scan. And the anticipated nursing care is we should start an continuous IV heparin infusion to the patient so as to prevent the clots to become larger and get dislodged in some other bigger arteries. And next important thing is that we should give oxygen via nasal cannula, as the patient is having pulmonary thromboembolism, so giving oxygen will help the patient to relieve dyspnea. To ensure that the treatment is effective, the nurse would monitor the important parameters such as the client's saturation level has been monitored via the pulse oximetry, and the vital signs are also monitored to see whether the respiration has settled, the heart rate has settled. And pain level would not be the most important parameter to be monitored here, because it is more subjective type when comparing to the vital signs. So there would be no need to monitor the other important investigations such as serum creatinine, because there is no indication in the assessment or in the question stating a patient is having any kidney disease. So the right option is always start continuous heparin infusion and administer oxygen 4 liter via nasal cannula. And the condition with the patient is experiencing is pulmonary thromboembolism, and the parameter what we need to monitor is vital signs and oxygen saturation, which is the most important at this particular time. So this is how we are going to solve this bow type question. I hope this has cleared your doubt regarding this bow type of question in NGN Nclex series. So if you have any doubt, please do comment, and thank you. Happy learning.